The Kaplan Productions' next blockbuster, the Chuck Norris of medical coaching. The big guy, the philosopher, the babbler, the Red Bull swimming in the Red Bull. Let's welcome Dr. Conrad Fischer!
Hi guys, and welcome to this novel lecture note series from Kaplan. My name is Dr. Conrad Fischer, and we will be doing this fantastic review of United States Medical Lunatics Examination Step 3. Today, I'm gonna make my way through your brains to make you feel more confident about USMLE Step 3. What you have been doing in Step 1 and Step 2 has to be now applied in a clinical vignette, where they will be giving you a list of meaningless information, and at the end of which they'll ask, what is the most likely diagnosis? What is the next best initial step? What is the most accurate diagnostic step? What is the best initial therapy? What is the most accurate therapy? You see? You see what I'm doing here? I'm cool, I'm high, I'm boss, and always on top. When you are done reviewing USMLE Step 3 subjects with me, you're gonna have the same feeling. You are always on top. You are always on top. In the words of great sportsman Muhammad Ali, to be a great champion, you must first believe you are the best. If you're not, you must pretend you are. Ain't it amazing? You know, I'm in the amazing business. 65-year-old woman is brought to the office by her son and husband for evaluation of confusion and behavior problems for the last few days. She has generally been medically stable. She has a history of type 2 diabetes that is well controlled with metformin and glimepiride. Mild osteoarthritis is controlled with acetaminophen as needed. She uses aspirin regularly. She takes lisinopril and consistently has blood pressure below 130/80. Her husband is upset because she has been incontinent of urine since these symptoms began. She passes urine in bed and on the couch at home. In the office, she has a visibly difficult time walking. One leg has decreased motor strength while the other is normal. Finger to nose and heel to shin testings are intact. Which of the following is most likely to be responsible for this problem? Is it anterior cerebral artery, normal pressure hydrocephalus, middle cerebral artery, Alzheimer's, PICA, or basilar artery? So what do we have here? 65 years old, hypertensive, confusion, urinary incontinence, and wobbly legs. Rest of it, it's just blah, 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 and blah. In fact, when I look at the question, I don't even see the other things. See, hypertension, confusion, urinary incontinence, and ataxia. The other day when I was doing my osteomyelitis routine, a girl comes up to me and says, "You are in the wrong profession. Look at Jim Carrey. You guys were born around the same time and look where he is. And I can tell you, he can't tell the damn difference between 21 and 23. And here you are, teaching us difference between normal pressure hydrocephalus and anterior cerebral artery stroke. You know, there is much more under this pretty face and globular head, isn't it?" You know what I told her? "Listen, lady, he may be in the pretty looking business, but I am in pretty amazing business." Yeah, that's what I told her. Well, I didn't keep a cab on time. I must have lost somewhere around 13 minutes and a quarter. You know, the extra amount of time taken doesn't matter as long as it's your time. Or extra amount of mortality doesn't count as long as it's your mortality. Yeah, right, whatever. So the difference between normal pressure hydrocephalus and anterior cerebral artery stroke is simple. When you have bilateral ataxia, dementia, and urinary incontinence, it's normal pressure hydrocephalus. When you have unilateral ataxia, confusion, and urinary incontinence, It's anterior cerebral artery stroke. You know, if you see these type of questions, you just determine what type of ataxia that is. You see which leg has gone weak, whether it is unilateral or bilateral, and bam! You're there. That's all. If you listen to me pretty close, you'll realize it's not so hard at all. If it is confusion, urinary incontinence, and unilateral leg ataxia, it is anterior cerebral artery that is choking. If it is nystagmus, ipsilateral ataxia, contralateral sensory loss of the body, and ipsilateral sensory loss on the face, and ipsilateral horner syndrome, it's lateral medullary syndrome. If it is dementia or confusion, urinary incontinence, and bilateral ataxia, it is normal pressure hydrocephalus. If it is ipsilateral deviation of the uvula with contralateral hemiplegia with loss of touch and proprioception, it is medial medullary syndrome. If you add some cranial nerve nuclei to these symptoms, you have lateral pontine syndrome. If you have ipsilateral oculomotor nerve palsy with contralateral hemiplegia with the toppings of Parkinson's disease with contralateral lower face, it's Weber syndrome. And if you have no idea what I'm talking about, it's Benedict syndrome. Feeling vertiginous? You don't know what that means, right? It's a $5 word for lightheadedness or dizziness or room is spinning. My head is spinning, man! Well, come here. Let me give you a nice hug and you will feel better. Okay guys, das vidaniya, alvida, ciao, I love you, mwah, mwah. And this is the end of Dr. Conrad's review.